Good day, viewers. This is another episode of SS Guni TV. It's been a while because of the Salah and then my wedding. I have decided to pause in creating my content videos. So today I am back to create another video, and the content of the video will be hypertension. So today we are going to talk about hypertension. How can you detect or spot the early signs and symptoms of hypertension? Stay tuned, I'll be right back.
SS Guni TV. Eat well, exercise, and live a healthy lifestyle.
Welcome back. So we said today we are going to talk about hypertension. That is the topic in this episode. We are going to talk about what is hypertension. Hypertension is the persistent elevation of blood pressure. Okay, so when there is persistent elevation of blood pressure, then we call it hypertension. In short, HPT. We call it in the hospital. So in books or in the website, they said when you have hypertension at a figure of 120/80, the 120 is the systolic and then the 80 is the diastolic. So when you have this, then your blood pressure is normal. Okay, your blood pressure is normal. But when it exceeds 130/90, okay, when it exceeds 130/90, then it's out of normal. Okay, then we will say that you are developing high blood pressure or hypertension. So our focus on today is the early signs and symptoms of hypertension. How can we spot hypertension? So that when we spot it early, then we will, seek for medical attention and also help in controlling it. So we have 5 signs that when you are developing hypertension, you will notice. And these signs are nose bleeding. Okay, early morning headaches. You'll be having headaches every morning. Okay, and then you will also having vision problem. Okay, blur vision, changes that way. And then we also have buzzing of the ears. You feel some kind of a car is moving in your ear, like the way the car moves, or a car is climbing a hill. How it sounds, like a track. So you'll be feeling that kind of buzzing in the ear, which is very, 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 very disturbing. Very, very, very disturbing. So we have them. There are 5. Buzzing in the ear, okay? Buzzing in the ear, nose bleeding, okay? You'll be having nose bleeding. Also, early morning headaches. You'll also be having early morning headaches. So when you are having early morning headaches, wherever you find yourself, if you are watching this video, when you see this sign, please, it's a sign of, it could be a sign of hypertension. Don't sit down, go to the hospital and get yourself checked. You might be having high blood pressure or developing hypertension. Okay, so we also have vision changes. You'll be seeing blur, as if smoky, like in the sky. It could be a sign of hypertension. So please take note of these early signs of hypertension. Hypertension is dangerous. It can kill, and it is killing people across the globe. So let's take care of ourselves, live a healthy lifestyle, exercise very well, eat good food, so that we will not develop these kind of conditions. Okay, so when we come back, we are going to talk about the risk factors. Okay, we are going to talk about the risk factors of hypertension. We are going to also add the risk factors. Very important. A lot of people don't know about the risk factors of hypertension. There are certain things we do that put us at risk, that keep us at risk. of developing hypertension. And these are the things that help us in developing hypertension. And viewers, please listen carefully. One, we have smoking. Okay, excessive smoking can, you know, help or promote hypertension in developing hypertension. So if you are smoking, you have to stop smoking. Because smoking causes a lot of diseases in our system, cancer, lung diseases, you know, uh, 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 neurovascular, diseases, a whole lot of diseases. So let's stop smoking. Okay, alcoholism can also put you at risk of developing hypertension, and alcoholism can also lead to what we call liver cirrhosis. Okay, so if you are taking alcohol, please avoid taking alcohol, or take at least a drink a day. It's okay. That is what is recommended by the expert. If you are a male, take 2 drinks a day. If you are a female, 1 drink a day is okay, in so that you might not get yourself into chronic conditions. Okay, so we also have hereditary. In some families, it passes through the family. The condition is in the gene. So you realize that when you go into somebody's family, they have hypertension. The mother is having hypertension, the aunt is having hypertension, the family is full of hypertension. Okay, so it's also, it runs into, it can be hereditary, and also race. According to books and research and my little research I have done, they are saying that Africans are more of developing hypertension than the white. But I beg to differ. I don't believe in that. I think the white develop more of hypertension than the blacks. Okay, because the hypertension, if you look at history, we were not having these conditions, and so, you know we started eating their foods, their refined foods and other things and lifestyles, and then we started developing these kind of lifestyle diseases. Okay, so be careful what you are eating in your stomach. Okay, eat natural, go natural. Okay, avoid eating refined foods. You stand the risk of developing hypertension. And also, sedentary lifestyle. Some people are very lazy. Okay, some people are very lazy. They are so lazy that they don't want to do anything. Whatever they want to go, even they want to go, at least go and buy something, at least they want to pick a car or a motorbike, you know, something small. They don't see them, they are very lazy and they eat a lot. So such a person can stand the risk of developing hypertension. And also, another risk factor is obesity. Okay, obesity is a risk factor. It can lead you to develop hypertension. Okay, and also electrolyte imbalance. When you have more sodium than potassium, you can develop hypertension. Okay, when you have more sodium than potassium, or you are retaining more sodium and losing potassium, you can stand the chance of, you know uh, developing hypertension. This is some of the risk factors I can, you know uh, educate you on. Please, if you are feeling this kind of, if you are in this kind of lifestyle, please avoid it. And if you are having this kind of early signs and symptoms, please visit the hospital. Visit the hospital. Don't just go to the pharmacy and buy anything and start taking. Visit the hospital and you will get better treatment at the hospital. Thank you so much for watching this video. Thanks for your support. I'm very grateful, even though I have been, because of activities these days, I've not been shooting video, but my short videos have been, getting views. Thank you for everybody for your love and your support. Uh, Thank you so much. May God bless you all. I'm out of here. Bye.